will be discussing the physiological changes that occur during a natural vaginal birth. Labour consists of 3 stages, with different physiological changes occurring within each stage. Stage 1 is usually considered the longest stage of labour, and it begins when the cervix starts to soften and open, and it ends when the cervix is fully dilated to about 10 centimetres. This diagram illustrates the cervix during stage 1 labour. As you can see, the uterus is here, the cervix is here, and the vagina is here. In the first part of this diagram, the cervix is not dilated at all as it is completely closed. As labour progresses, you can see the cervix is beginning to open slightly here to roughly about 1 centimetre. As the diagram continues, the cervix here is fully dilated to 10 centimetres, indicating the end of stage 1 labour, as you can see the differences between each stage as stage 1 progresses. During stage 1 labour, your waters also break, as the fluid will be expelled through your cervix and your vagina. A bloody, stained mucus, called a show, is also likely to occur, which will be also expelled through your vagina. Women may also experience backaches and an urge to go to the toilet. Stage 2 labour begins when the cervix is fully dilated to 10 centimetres and ends once the baby is born. This diagram illustrates what happens during stage 2 labour. As you can see at the beginning of the diagram, the baby's head is starting to emerge out the woman's vagina. As the diagram progresses, the baby rotates in order to deliver the anterior shoulder and posterior shoulder. At the ending of the diagram, the baby is fully delivered as well as some of the umbilical cord, indicating the end of stage 2 labour. Stage 2 labour also has longer and stronger contractions than stage 1 labour. During stage 2 labour, women may also have an increased pressure in the bottom and increased urge to push. Stage 3 labour begins when the baby has been born and ends once the placenta has been delivered. As you can see through this diagram, the placenta is currently not delivered and neither is some of the umbilical cord. Women will experience contractions in order to expel the placenta and the umbilical cord out the vagina. However, these contractions will not be as strong.
Today I will be discussing the assessments performed during labour and a normal vaginal birth. So a CTG scan is often performed during labour to monitor the baby's heart rate, just to ensure everything is progressing normally. So this diagram shows a CTG scan that is being recorded during labour, and as you can see, labour alters some of the processes such as heart rate of the fetus, which is represented here. During contractions, which is represented by the waves at the bottom, so here's one contraction, a rest period, another contraction, the baby's heart rate increases, as you can see by these steep lines here. So for example, during this contraction here, the heart rate increases to about 150 beats per minute, and then when the woman is in the resting stage, it maintains a more stable heart rate of about 120 and 110 beats per minute. Also, in the first stage of labour, you should auscultate the baby's heart rate for 1 minute, 15 minutes after a contraction, as the contractions are quite long apart, so you're able to do that in the first stage. And then in the second stage of labour, you should auscultate the heart rate for 5 minutes following a contraction. So this is a representation of essentially what's happening during a contraction. So the uterine walls, which are represented by this black line around here, are contracting, and this pushes the fetus towards the birth canal and out towards the vagina. And as you can imagine, the contraction places a lot of strain and pressure on the baby because it is literally being pushed out of the uterus. So this is why the heart rate increases. And when the contractions are in a resting stage, the heart rate maintains So here you can see a vaginal examination being performed, and these are performed during labour just to see how the baby is progressing and how far the labour is. So the cervix, which is just here, it dilates as labour progresses. So by feeling how far the cervix is dilated, you can kind of tell how the labour is progressing and things. And you can also see what the presenting part of the baby is. So here you'd be able to feel like the round surface of the head, but if the baby was in a breech position, you wouldn't be able to feel like a smooth, you'd probably feel a foot or something like that. And it provides approximate information about how long the birthing process is going to be, depending on how far the cervix is dilated. And once the cervix has fully dilated, it will have a diameter here of 10 centimetres, which will allow the baby to fully move into the birth canal. And lastly, labour pain is also assessed during labour to see how the woman is coping. And although people usually associate pain as being something that is negative, it actually is a positive tool as it can help assess how the birth is progressing, because the woman is expected to feel pain during birth, and then if she's not, it can be a negative sign. Expressions of pain can be verbal, such as like the woman yelling or moaning, or it can be non-verbal. So things such as facial expressions, or maybe she's clenched up, or just the position she is in. And this visual analog scale, this can be used to assess how the woman is coping. So this end represents here no pain. So if the woman was maybe in the early stages of labour and her pain was very little, she'd point to around this end. And then over here we have pain as bad as it could possibly be. Alright, so today I'm here with Gabby, and she is currently 37 weeks pregnant, and I'm just going to be auscultating the baby's heart rate just to check that everything is progressing normally. Do you mind if I just have a little listen to your tummy at all? Yeah? Okay, so I heard a heart rate of 120 beats per minute, which is completely normal. Yeah, babies' heart rates tend to be a little bit quicker than ours. The normal range is 110 to 160, so 130 is perfectly normal. So today I'm here with Kelsey, and she's currently in the 3rd stage of labour. As you can see, she's experiencing quite a bit of pain. We've just completed a vaginal examination, and her cervix has dilated 9 centimetres, so she's quite close to being fully dilated. I'm just going to assess her pain now using the visual analog scale. Hi Kelsey, are you alright? You coping?
No!
No? So how would you rate your pain? Is it really bad, the worst you've ever felt?
Yeah, so bad.
Is there anything I can do for your pain? Some medication?
Yeah, maybe.
I'm Gabby, and today I'm talking about the role of the midwife during labour. The relationship that's developed between a midwife and her patient is unlike any other clinical relationship. The midwives have the opportunity to provide intimate care with the woman, become one of their primary emotional supports during the time. So midwives are there from conception to birth, so quite a long journey to develop that relationship. Care doesn't end once the baby's delivered, and in fact midwives are involved with mum and bub after birth as well. During pregnancy, midwives are there to monitor the baby's growth, like including the position of the baby and its rate of growth, just overall health of mum and baby. Midwives are also there to educate and advise expecting mothers about hospital bookings and any necessary checkups. They're also there to provide all forms of support with no judgment. They're basically there to prepare mum as best they can for delivery. During labour, midwives are there to encourage and support their patient and to develop plans for assisting in labour for specific situations. They keep track of the fetal heart rate during the process. They're there to arrange any medical help, including medications or involving extra people if required. The midwife is there to ensure that the baby and mum are delivering in a safe environment, which sometimes includes midwives attending home births or free births. The midwife has the best interest of the baby and the mum at heart, and this is what makes the intimate relationship between the midwife and the patient so unique.
Kelsey, and I'm just going to be talking about the role of the nurse after birth. So basically in Victoria we have this system called the MHS, which is the Maternal and Child Services, and they basically just conduct home visits at weeks 2, 4 and 8 postpartum, as well as 12 months, 18 months and 3.5 years of age. And the role is basically just to ensure that the women and the baby and the family members, everyone is okay, and they're progressing all right. So that could be, you know, help with breastfeeding, nutrition, giving them hints on how to sleep, you know, just that sort of stuff, and just any general advice on how to recover at home after a normal labour and delivery. In terms of how what we do in particular for the women, which is our main focus, is assessing them for any physical or emotional issues that might have been caused during the birth or during the pregnancy. So basically we just give the women a very open space to discuss any issues or concerns that they might have. So for example, we could ask them, you know, have you been feeling a bit overwhelmed? Do you have family members that can help? You know, frustrated and everything like that. We do have a 24-hour call line, so if after the visits something pops up and they're like, oh, I've just got a question, you know, they can just give them a call and they're very happy to answer any questions or queries that they might have.